Implant Pilot is a revolutionary new system developed to increase the precision of implant placement whilst being less invasive and thus reducing discomfort for the patient. It takes advantage of the latest digital technology to be able to plan the implant placement virtually on a computer well in advance of the actual procedure. This maximises the use of the available bone, means problems can be anticipated and allows for optimal positioning of the implants. Firstly, the planning establishes the appearance of the final teeth, then makes the implant positions correspond to that, so a predictable final result can be achieved. Finally, it opens up the possibility of placing implants and attaching prefabricated teeth at the same appointment. The digital planning combines a three-dimensional CT scan with a scan of the plaster model and then relates the two by use of a marker on both scans. The planning software is used to design a jig which is 3D printed in titanium. This jig controls the position of the drill, which in turn gives the precise implant placement. Conventional implant treatment requires the gums to be cut and folded back to be able to see the bone at the implant site. However, using Implant Pilot, it is no longer necessary to cut the gums as the implants can be placed accurately without having to visualise the bone. By using this keyhole technique, there is much less tissue damage and so less post-operative discomfort. No sutures are required. There is less risk of bleeding and the procedure can be usually completed in a fraction of the time. The guides that are fabricated are unique to the patient, which does mean that there's an additional cost for this procedure. I will now take you through an animation showing the procedure step by step. Here we can see an impression being taken of the patient's mouth. With the impression still in place, a CT scan is taken. The impression tray has a Lego brick attached to it. This Lego brick shows up on both the CT scan and the scan of the model and is used to correlate the CT information with the model information. The impression is used to pour up a plaster model and then this is scanned. The model is scanned again, but this time without the impression, and finally a simulation of the replacement teeth are added to the model and the model is then scanned for a third time. Both the CT scan data and the model scans are loaded into the software and the position of the implants carefully planned. From this data, a metal jig is fabricated, which will guide the implant placement. In this particular case, the jig is very complicated as there are multiple implants being placed. The jig is secured in the patient's mouth and sometimes this is supported on the teeth. If there are no teeth, it can be screwed directly to the jaw. A pair of legs guide the head of the implant drill so that the implant is placed in the correct position. The Implant Pilot drills are made out of zirconium, which is a very sharp, clean material that cuts very effectively with minimal tissue damage. First of all, a plug of tissue is removed and then the drilling sequence is followed as per the prescription. The guide can also be used to insert the implant. In this case, multiple implants were used. The guide is removed and it is possible to fit metal posts or abutments to the implants and then use these to secure the teeth. The whole process typically takes half the time of a conventional implant placement and results in far less stress and post-operative pain for the patient. If you would like to know more about Implant Pilot, please go to implantpilot.co.uk.